This morning, we are learning more about how a simple flu shot may offer protection against Alzheimer's disease. ABC's medical correspondent, Dr. Darien Sutton, is here to break this all down for us. So what does the study say?
Good morning. So the big question here in this study is, does the type of flu shot that you get affect your risk of developing Alzheimer's disease? And they compare two common types, the standard dose and the high dose that we give to adults over the age of 65 during the flu season. And they found that older adults over 65 who got the high dose vaccine, that was associated with a 10 to 20% reduction in the risk of Alzheimer's disease, and that protective effect lasted for about 2 to 2.5 years after that vaccination. Now, on an individual perspective, these are marginal benefits at best, although statistically significant. But if you think about it, guys, over the population, millions of Americans getting their vaccine, older adults encouraged to get it, that potentially means thousands of fewer cases of dementia every year.
But I think this begs the question, how is the flu even related to Alzheimer's?
This is such an important question. When you think about Alzheimer's disease, it's difficult to understand how that can be related to an infection. This study shows an association, right? So it shows that getting your flu shot is associated with a reduced risk of Alzheimer's disease. It doesn't define a cause and effect. But Gio, we do know that flu infections cause widespread inflammation in the body. That's the basis for complications of the flu. For example, flu encephalitis, we see it every year. It also causes brain degradation. And so that's the basis there. And also in terms of getting the high-dose flu shot, many people will say, should I get it even though I'm not over 65? But based on the best available evidence, that added benefit only comes after 65 because our immune systems fade with time or get weaker with time. So it's more compensating rather than adding.
It really is fascinating, though, but have any studies actually looked at the correlation between these annual vaccines and Alzheimer's disease?
A great question again. So actually, yes, and it's continued to be studied. When you look at the standard dose benefit, studies show that you can have a reduced risk of Alzheimer's disease if you get your standard flu shot, anywhere from 17 to up to 40% of reduction. But so important here, we have some things on there on your screen that you should pay close attention to, because up to 45% of cases of dementia are deemed preventable by things that we can control in our everyday life. Exercise, high quality diet, minimizing highly processed foods, getting consistent quality sleep, and the top one, controlling and most importantly, checking your blood pressure. 1 in 2 Americans have high blood pressure. Only 25% have it under control. That is a strong risk factor. Remember, protecting your body is also protecting your brain.
You said 45% preventable?
Yeah. Up to 45% of cases of dementia are preventable, and we're learning every day it's not something that you just get. Although there are genetic risk factors, there are things that we can do every day in our life that reduce our risk.
Wow, I didn't know that. That's extraordinary. Okay, let's talk about some of the limitations with this study.
Yeah, so this study, it got that data by using insurance claims. Now, that is not representative of the entire population because not everyone has access to quality care. And so there are some missing variables in here, but Rachel, it adds to that growing data and evidence that shows, again, protecting your body, doing these changes in your life, and making sure that you're getting that high quality diet, getting that exercise, making sure you're getting that sleep, and getting your appropriate vaccinations to reduce your risk of complications of infections. All of these add to reducing your risk later in life. Again, you want to treat your body like a home you have to live in for the rest of your life, and that's the best way you want to take care of it.
Yeah. Really, really fascinating conversation. And anyone who's following you on social media knows, by the way, you've been recovering. You're doing really well with your leg.
I'm learning how to be a patient.
Yeah, that's right. The crutches are off to the side.
Yeah. We hit them well.
Yeah. All right, Darien, thank you so much.